I want to shed some light on things nurses should consider before they start taking the time to not only research this area, but actually pursue this area and then pay money to go back to school for this area. Welcome back to my YouTube channel. My name is Brianna, and I am your nurse innovator and dream facilitator. Think career strategist meets big sister. In this video, I want to talk about things you should consider before paying for your nursing informatics degree. In this video, I want to share the conclusion that I've come to that I think is very important to share after having gotten my Master's of Health Sciences with a concentration in informatics. And not only the realization that I've come to, but I want to shed some light on things nurses should consider before they start taking the time to not only research this area, but actually pursue this area and then pay money to go back to school for this area. I know I've talked with, and even recently, nurses that are drawn to nursing informatics for the exterior of what it represents. Nursing informatics, if you're looking at it from being at the bedside, being in the hospital, giving direct patient care, or being in a clinic and being on your feet every day, nursing informatics can be a specialty that you are drawn to, especially because it is marketed or perceived as one where you can work as a nurse that is remote, or one where you can work as a consultant, or one that allows you to be at a computer, whether you're working remote or not. While all of those things are possible perks of nursing informatics roles or jobs, depending on whichever one you land, I want to give a little bit more tangible insight into the different roles and which one you may align more with, and how to better research these roles before you start considering that nursing career pivot or strategizing towards that area. So as I said, the appeal for the nursing informatics specialty can be misunderstood if not clearly articulated or researched. In my journey from working in the hospital for at least 2 years and knowing, even before being in the hospital and knowing in nursing school, that I was drawn to it, in that process, from going from there to getting my master's, but also talking to other nursing informatics specialists and content creators online, I came up on an interesting insight. And this insight I received actually from a webinar that I attended, and it was under the content creator. It was with the content creator, Amanda Payne, Nurses in Tech. She created a community that allows nurses who are interested in tech or informatics to come together and learn from each other. And so what I learned from one gentleman who was on there was nurses who are drawn to informatics almost need to determine which category they fall into, right? So in this specialty, you can either be super technical, you can be administrative, slightly technical, or you fall into the more entrepreneurial innovation pocket. So we're looking at 3 categories. Let's go into that a little bit more. Disclaimer here. Please do not take what I say and my description of each of these roles to be a hard, fast rule, or like, oh, Brianna said it, so it must be right. Anything you see on the internet from any content creator or even any business, you want to research for yourself. And so I am being transparent here, using ChatGPT to kind of share with you some general insight on each of these roles. And again, every role, depending on the different companies, may be a little bit different. Responsibilities of each role can overlap each other, but we're talking about this generally so that for the purpose of this video, you can understand what I mean by the three different sectors. So super technical nursing informatics roles are the clinical informatics analyst. So they work directly with data systems, they work with the EHR, they work on the back end. A health data scientist, or somebody that is working closely with health data, or a nurse who's working closely with health data, they are doing data modeling, data analysis, doing predictive analytics that shed more light on clinical outcomes, shed more light on how to treat a patient based on results and statistics and findings, whether things have improved, whether things indicate gaps, right? They're really delving deep into data and are good with probably statistical methods or systems that allow you to compute statistical methods. Clinical decision support specialist, this can be a nurse. Sometimes it doesn't have to be a nurse, but nurses can operate in this kind of nursing informatics role. They help build and test decision support tools. So EHRs often have decision support mechanisms in there, and so they're a part of that tech that helps the physician or the nurse, the PT, OT, whatever multidisciplinary individual to make decisions for the patient. Then you have your nurses that can work closely with FHIR or interoperability. These are nurses that work closely with HL7, FHR, API-based integrations. I'm not even gonna pretend like I know what those are. HL7, I'm familiar with it. It's, I think, a type of language, but anyways, like I said, these super technical roles are roles that require being comfortable with data, systems, coding logic, and they work directly with technical teams. They work directly with like the IT people. For your more administrative, clinical liaison roles, this is somewhere in the healthy middle of being super tech and not clinical every day, even though sometimes you can still be very clinical. You just get that adjunct of being technical. Clinical informatics nurse is that liaison between the IT people and the clinical team. They take what the clinical team sees, feels, experiences, translate the needs to the IT people. The IT people try to get it done, translate what they've done back to that liaison, who then helps their team adopt to any new changes that are made. So they are that middleman who's very a part of structures and changes. The nursing informatics specialist is likely the same kind of role. And so, like I said, if you're in the administrative clinical pocket, you're somewhere in the middle of sometimes being on the floor, if you're in the hospital, sometimes serving clinics, serving patients directly in the clinic, whatever kind of setting you're in, you're still hands-on patient care. You may even be like nurse manager or team lead or something like that. You have a leadership role, but you are still that liaison for the super technical people. So that's the healthy balance there in the middle. Sometimes also too, you can be an educator. So you can be an educator on a specific topic, like a subject matter expert. And part of you being a subject matter expert requires you to be a part of the technical conversations around the systems that support the specialty that you're serving. It could be a specialty in terms of the patient, a specialty in terms of the unit itself. For me, I worked in the public health setting, and so tuberculosis is my specialty. And when I was in the clinic, I volunteered to be the super user to help my team use what you call an outdated or a legacy system, one that's not up to date like all the nicer ones, help us make that better to help us provide case management to our patients. So that's your middle ground. And then lastly, the third part is the more entrepreneurial or innovative side that nurses are drawn to when considering nursing informatics. And I think I didn't necessarily fully realize this when I was drawn to nursing informatics, but what piques my interest most is the gateway that nursing informatics allows you to then explore more innovative, creative, entrepreneurial sides of healthcare in general or nursing in general. So when you think about this area, you're thinking less about internal hospital systems and more about innovation, startups, ventures, consultant, business owner, that sort of thing. So some of these roles can be a digital health consultant, they can be a tech founder or a nurse tech founder, someone that has started a special app or a special business. They could also be a healthcare product manager. So maybe they are working for, let's say, trying to think of the word. They're working for a company that sells a medical product, a new medical product, or a medical product that has been on the market. The nurse can either be like a part of that sales process to take that medical product, educate hospital systems on it or clinics on it, whether that's an EHR or a medical device. They can be a part of the sales, they can be a part of solving problems when those people purchase the product and then apply it to their unit or their workflows. So they can be a part of troubleshooting the problems, going out to the field, to those places, and helping troubleshoot the issue. They can just be a part of the business itself, right? If this is a startup and it's a new medical device that they are creating or marketing, they could be a part of that team that is actually educating people, creating the product, just all the business logistics around the new venture from the beginning itself to getting it out to market. And so that is more of the entrepreneurial side of nursing informatics. Now, for those of you who have been watching my channel for some time already, you know that I talk about nursing informatics often. It's something that I enjoy talking about. However, I am not your typical nursing informatics content creator that you may have come across. I very much so identify in more of the entrepreneurial lane. And so on this channel, I'm going to be talking about a variety of topics because what drives me is helping nurses feel unstuck, helping nurses feel more aligned to their mission or their journey, wherever they are in that nursing journey, and helping them leave direct patient care if that's somewhere they want to leave, or get back to it. I'm very good at writing, and so my services are resume writing, LinkedIn strategy, job search, and I just recently added a new service, which is the financial strategy. The financial strategy has been a big part of allowing me to work for periods of time and then take breaks for periods of time to build my business. Now with nursing, we as nurses, we have this flexibility, right? We can go from A, B, C, D types of jobs because that's just how our licenses work. However, we don't always have the financial prowess. We may still be living paycheck to paycheck and not the best at balancing how to make those transitions, how to be strategic about those transitions to then feel comfortable to pivot. So that is what I offer in my services, and that is why I am your nurse innovator and here to facilitate your dreams. I hope in this channel, at least what you came away with was thoughts to consider when figuring out what exactly draws you to nursing informatics and how to make the best decision in either purchasing a certificate or just applying to a job without experience to see if you would like it, or even going back fully to get another degree in the specialty. Outside of that, if you do need assistance with writing your resume or making a career transition, please click on the link in the description below and you'll get some more information on details of my services. I look forward to talking more with you, sharing more. Leave a video if there was something really specific that you piqued your interest or that you would like to know more about. And I look forward to creating more content. All right, guys, that's all I have for you today. Bye.